I do see myself as one that has survived, can survive, will survive.
We took it on as we're fighting this. I'm going to win.
Tonight, as part of Breast Cancer Awareness Month, Penn State Milton S. Hershey Medical Center presents Hope and Courage, a tribute to breast health.
Good evening, I'm Chuck Rose. Thanks for joining us. You know, by the end of this year, it's estimated over 190,000 new cases of invasive breast cancer will occur among women in the United States, and about 1,900 new cases are expected for men. In Pennsylvania alone, about 27 women will have been diagnosed with breast cancer by the end of today. The good news is, since 1990, the death rates from breast cancer have continued to decrease because of earlier detection and improved treatments. So that's what we're looking at now. Throughout tonight's show, we have a few stories to share of hope and courage, and one such story comes from York County, where a woman found that the support from her husband and family helped her through a very difficult time.
You certainly have a lot to live for.
Barbara and Jack Roach reminisce about their trip to Walt Disney World with the grandkids earlier this year. A magical place where dreams can come true, and theirs did.
It was wonderful to be able to experience that with them and seeing where we had come from, and in such a short time to be that healthy and feel like that there's a whole lot more of shared experiences in the future.
Healthy and happy now, but that wasn't always the case. Barbara remembers the day her hopes and dreams faded.
He called me the diagnosis on September the 19th.
A breast cancer diagnosis.
My first instinct was to think, well, I was going to have chemotherapy, and there were a lot of horror stories running through my brain. So I was sad at first and then really fearful.
We both had breast cancer. I mean, I didn't, but she has been so close to me that there was no way of me not sharing in everything that she was going through.
We've been married 46 years, so 44 years when I was diagnosed. So we know a lot about each other, and he knew that for us to get together, it had to be a team effort.
Their two sons and their families quickly found out the news.
I emailed them both to lay the groundwork so that they would be ready to talk. And as soon as they got the emails, I got 2 phone calls. But it was wonderful to hear that whatever we needed, they were ready to help, and so that was hard.
Barbara had 2 lumpectomies that show cancer sprinkled throughout her left breast.
Her tumor would require that she needed chemotherapy, and we felt at that point in time it would be best to proceed with the chemotherapy next and do the mastectomy later.
Surgery and radiation treats the breast, but we give medication through the bloodstream, chemotherapy or hormonal therapies to treat any cells that may have left the breast that in the years to come could cause a recurrence.
Barbara was at Penn State Milton S. Hershey Medical Center almost every other week for chemotherapy. It lasted for nearly 4 months.
It was tough. Dr. Cream
Barb did very well through all her treatments, although she did have quite a few side effects, and it wasn't easy for her. But she had the support of her husband, and he was very involved and came with her to every chemotherapy visit. And in addition, she had a wonderful, positive outlook.
We took a drive every day. I mean, there were a few days when she just couldn't get to the car, but I'd get her in the car and we'd go for a drive.
After chemotherapy, Barbara chose to have a double mastectomy. Almost a year of her life wrapped up in this disease called cancer.
Remember Pluto crawling on the ground and kissing everybody?
But now, their dreams have come true.
All the cancer was gone. All of the other tissue showed no signs of cancer. That's a very reassuring feeling.
Now, Barbara is part of a clinical trial at the Med Center. She's taking osteoporosis medicine. It's to reduce the risk of breast cancer returning. Now, Barbara did have a family history of breast cancer, but testing proved it was not passed on to her genetically. Back to you, Chuck.
Thank you, Deborah. And joining us now in the studio is Dr. Rena Cass, the co-medical director at Penn State Hershey Breast Center. And Doctor, we get a lot of calls in shows like this when they talk about family history for breast cancer. What do the studies show, the likelihood of this happening according to family history?
Well, family history does impact on the risk of breast cancer. And intuitively, the more relatives that you have with breast cancer and the younger those relatives are, the more risk that you would have. What would be some of the warning signs that you might be at higher risk for breast cancer? Well, the following things. Members of your family that have bilateral breast cancer, multiple members of your family with breast cancer, members with ovarian cancer, a man with breast cancer in the family, someone in the family that's of Ashkenazi Jewish descent. Some of those things can be warning signs for being at higher risk.
Okay. Now, another common misconception might be when it deals with lumpectomy or mastectomy. What determines if a woman needs one or the other?
Well, first of all, it's important to realize that the two treatments, breast-conserving therapy and mastectomy, are equivalent for patients in overall survival. And a breast-conserving therapy would be the lumpectomy, taking out the area of tumor and giving radiation and doing a mastectomy. But not everyone is a candidate for breast-conserving therapy. So the way we determine whether someone is a candidate for that is we need to prove that the disease is confined to only one area of the breast and they can have radiation. So how do we prove that it's in only one area of the breast? Well, we look closely at the mammograms. We do a clinical breast exam. We perform an MRI, which is the most sensitive screening process we have for determining other areas of disease. And if the disease is unifocal, then we determine if they can have radiation. If they're pregnant or if they've had radiation before, then they wouldn't be a candidate for breast-conserving therapy.
Every case is separate.
Every case is separate, and it's also a personal choice. Someone might be a candidate for breast-conserving therapy, but they may choose to have a mastectomy, and that's okay.
Now, joining us here in the call center is Michelle Farnan. She's from the Best Breast Center. She's going to help answer some of these viewer questions. Thanks for being with us tonight. The first viewer question: I once felt a lump on my breast, but it went away and has never returned. Should I still see a doctor?
At this point, if the lump has gone away, you do not have to see a physician now, but it's most important that you continue to do your monthly self-breast exams, get an annual mammogram, and see your physician.
Okay, and here's another viewer question. Recently, I've had pain in my breast after drinking a lot of caffeine. I've heard other women say the same thing. What is causing the pain? Is it dangerous? And does this go as far as chocolate, too?
Definitely chocolate and caffeine. Women with fibrocystic or very dense breasts might notice an increase in discomfort, maybe even pain in their breasts after they've had too much caffeine. However, it is not dangerous, and it is important if you're scheduled for your mammogram to cut back on the caffeine and maybe the chocolate a little bit 3 or 4 days before you come in for your study.
And isn't it true that younger women do have dense breasts?
Yes, it is true. Young women have very dense breasts, and as we age, they become more fatty replaced and less uncomfortable.
Okay, great. Thanks so much, Michelle. And we'll have more viewer questions, but we'll send it back to you, Chuck.
Thank you, Deborah. We're going to be taking a quick break right here, and when we come back, we'll learn about Barbara Moore's story of hope and courage.
Researchers at Penn State Milton S. Hershey Medical Center need volunteers for a breast cancer prevention study. If you're a postmenopausal woman in good health, you may be eligible. For more information, call 717-531-4300